So now we are going to see the pharyngeal arches. So pharyngeal arches is normally embryological structures which give rise to the neck region structures. So normally there are 6 arches which is referred as pharyngeal arches. So fifth arch will be disappears earlier, so there are totally 5 arches such as first, second, third, fourth and sixth arch. These are the 5 arches which gives rise to the neck structure regions. So these are the 5 arches. The violet color is the endoderm, whereas pink color structure is the exoderm, and between them the mesoderm is presented, and the close relation between these three layers is referred as pharyngeal membrane. So, and then the space in the ectoderm is referred as ectodermal pouch, and space in the ectoderm is referred as ectodermal cleft. So some structures develop from the ectodermal cleft and some structures develop from the endodermal pouch. So as then the second arch extends and descends downwards and joins with the sixth arch and forms the cervical sinus. This cervical sinus will be obliterated. This second arch will be attached with these arches and get obliterated. So only the first ectodermal cleft gives rise to external auditory meatus, and the first pharyngeal membrane gives rise to tympanic membrane, and the second, third, fourth and sixth ectodermal cleft does not give any derivatives. Then we can move to endodermal pouch. So endodermal pouch, we have first, second, third and fourth. There are 4 ectodermal pouch. 1, 2, 3, 4. 4 ectodermal pouch. So from the first ectodermal pouch, tubo-tympanic recess will be formed, such as tubo, which represents the auditory tube, and tympanic, which refers to the middle ear cavity. So these two forms from the first endodermal pouch. From the second endodermal pouch, palate and tonsils will be developed. From the third, inferior parathyroid gland and thymus. So from fourth endodermal pouch, superior parathyroid gland will be formed. So these are the derivatives of the endodermal pouches, and we have seen the first ectodermal pouch derivatives. So now we are going to see the derivatives of the mesoderm, that is pharyngeal arches. So we have first, second, third, fourth and sixth pharyngeal arches. So we are going to see the derivatives of these pharyngeal arches now. So from the first arch, we have derivatives of bones, cartilage, nerve, artery and muscles. So first we have to see the embryonic cartilage. So first arch of embryonic cartilage is the Meckel's cartilage, and the second arch embryonic cartilage is the Reisner's cartilage. So for the third arch and further arches, we does not have the embryonic cartilage. For the first and second, we have the embryonic cartilage. And the bones from the first arch is the maxilla, mandible, incus, and most of the skull bones will be formed from the first arch. And nerve of the first arch is mandibular nerve. The nerve which supplies the muscles, the mandibular nerve which supplies the muscles, comes under this first arch. So muscles of mastification, which is supplied by mandibular nerve, tensor, tympani and mylohyoid, and anterior belly of digastric, all these are supplied by mandibular nerve. So it comes under the first arch, and the artery of the first arch is the maxillary artery. So coming to second arch, we have bones. One is stapedius. So nerve is facial nerve. The muscle which is supplied by facial nerves are muscles of the facial expressions, stylohyoid, posterior belly of digastric. All these muscles are supplied by facial nerve. So it comes under the second arch. An artery of the second arch is the stapedial artery. So coming to third arch, the bone which is derived from the third arch are greater horn and upper body of the hyoid. This is the hyoid bone. So the greater horn in the sense, this is the greater horn, and the upper body is derived from the third arch. And the nerve is glossopharyngeal arch, which supplies only one muscle, that is styloglossus muscle. The artery is common carotid artery. Coming to fourth arch, bone is small horn and lower body of the hyoid bone. A nerve is superior laryngeal nerve, and the nerve which supplies the muscles are cricothyroid, consistor of the pharyngeal muscles such as superior, middle, inferior consistors, and we have levator veli palatini muscle. These are supplied by the superior laryngeal nerves and its branches. So artery is subclavian artery. Coming to sixth arch, as we know, fifth arch disappears yearly, so it does not give any of the derivatives. So coming to sixth arch, bone is a bone. It does not give any rise to bone. The cartilage, the laryngeal cartilage, all are formed from the sixth arch, and the nerve is recurrent laryngeal nerve. And the muscles are all intrinsic muscles of larynx, which is supplied by the recurrent laryngeal nerve, and the arteries pulmonary arteries. So these are the derivatives of the pharyngeal arches. Thank you.